actually realize, hey, this is why I became a doctor in the first place. I'm doing stuff here that I really trained for and wanted to do my whole career. And I'm on one of these expeditions and I'm actually doing it now. This is what I trained my whole life for. So I think it's an amazing opportunity.
Welcome to the World Extreme Medicine podcast. My name is Pavandeep Singh. I'm honoured to be the resident ophthalmologist for World Extreme Medicine. And today I'm even more honoured to have with us a very experienced ophthalmologist who I am very privileged to call a friend, a teacher, a mentor, and a genuinely all-round excellent guy, Mr. Jeremy Joseph, a consultant ophthalmic surgeon. Who will be talking to us today about his, adventures and expeditions in cataract surgery and ophthalmology, fairly, across the globe, really. Mr. Jeremy Joseph is a consultant ophthalmologist who began his medical school training in 1977. He then conducted his ophthalmology training at the Royal London Hospital in Barts and the Royal Free and Moorfields. He was appointed as a consultant in 1994, but interestingly, just before he started his post, the whole eye department resigned, which will be something we'll be talking about, and he then continued his post at the Central Middlesex Hospital. Mr. Joseph retired from practice in 2018 with the intention of continuing to work abroad for charities, and it is through that how we met. And I was really lucky that I was able to go with Mr. Joseph to Bolivia in October of 2022, where he trained me in manual small incision cataract surgery, which is something we don't get trained in the UK. So I was very lucky to have that. And he has made me independent, helped me become an independent surgeon in that methodology. I still have a lot to learn. And we thought it was a really good idea to get Jeremy on the podcast for our audience, because Jeremy, I think, encapsulates everything that WEM stands for in terms of taking medicine out there and taking our skills and our humanity out to the world where people have low resources and where we can actually use our hands on to make a big difference. So Jeremy, welcome to the podcast. Thanks for coming on and giving us your time. Tell us what happened when you were appointed as a consultant back in '94.
Well, I was appointed at Edgware Hospital, and the interview actually didn't go all that well, because they said to me they weren't absolutely sure whether there was going to be a job or not, but would I like to continue with the interview anyway? And I thought maybe this was just like a kind of test to see how resilient I was, and I wasn't really sure whether they were being genuine or not. Anyway, the interview proceeded, and a couple of days later I was told, well, actually there was a job and I was appointed. But then a few weeks later, I was phoned up by one of my co-consultants, to be, if you like, and she told me that the whole department had resigned, which was a bit of a shock to the system. But I think one of the things it did teach me is a little bit more resilience and perhaps an expectation that things don't always go according to plan. And I certainly think that that's come in handy with some of the expedition medicine that I've done ever since.
That's interesting. Yeah, not the ideal start to a consultant post.
But no, not really.
What you mentioned goes on really nicely to what we're going to talk about today. So that uncertainty really, I guess, underpins a lot of expeditions. How did you get started in the world of expedition ophthalmology?
Well, again, it was something fairly unexpected, because I was a senior registrar just about to finish my junior doctor training at the Royal Free Hospital. And I was approached by one of the consultants who was due to go to South America, to Brazil, on an expedition. But she was pregnant and felt that because she'd have to take anti-malarial tablets and so forth, that this was not a good time to go on one of these remote expeditions, and asked me if I wanted to go. Again, this just came out of the blue, and I thought, well, it sounds like a great idea. And not long after that, I ended up in a place called Santarem on the Amazon River. And this was my first expedition abroad. And it was, real eye-opener, if you excuse the pun. It was a fantastic opportunity to actually see some ophthalmology out there in a place that really didn't normally do eye surgery. And really, that was the start of a great thing for me. It was really a tremendous opportunity.
Okay, so you were a senior registrar near the end of training. How old were you roughly, and what did you do out there?
I was about 34 years old, if I remember correctly, and I worked with a group of American ophthalmologists who all came from Memphis, Tennessee. I thought they'd be Elvis lookalikes, actually. But they were a great bunch of guys, and for me it was a bit of a revelation because I was, if you like, the most junior of the whole team, but not that junior. And I felt I sort of held my own, and I felt that I could actually operate at much the same level as these other guys. And I suppose it was a little bit of an awakening as a surgeon that, hey, this is actually something I can do, and I think I can enjoy it, and I think I can make a contribution. And from that moment, really, I decided to continue to do these kind of expeditions as much as I could during my professional career, and I've managed to do that ever since. So it was a great opportunity.
And do you think we all need that kind of process at some point in our stages as surgeons, where we sometimes think when we may not be good enough, but just the circumstance pushes us and we realize, actually, I can do this, and then you see a whole new world open up to you?
I think it's very good for everybody. I'm not sure that literally every surgeon needs it, because there are obviously some types of surgery that don't lend themselves to this type of expedition. But ophthalmology, and in particular cataract surgery, is ideal for this sort of expedition type of medicine, because it's a fairly self-contained condition which doesn't need intensive hospitalization or intensive care or anything like that. And as long as there's some degree of follow-up, I think it's a safe procedure to do in the field like this. So I certainly think for ophthalmologists, it's something that it's very important to do.
When you came back from your first trip, what would you say were the main learning points you had?
Well, it was learning that I could hold my own as a surgeon, learning that the skills that I'd learned up to that point were actually something that was really extremely valuable, and that I could make a contribution to treating blindness in people. Sometimes I think as a junior doctor, in fact, even as a senior doctor, you sort of wonder, what are you doing? The whole NHS can get you down, the whole bureaucracy and so on. Whereas when you go on one of these trips, you actually realize that your surgical abilities can really make a tremendous difference to people. And you're in a position where you personally can actually do the procedure. You're not working through some other kind of charity where you have no idea what's happening to your charitable donation. Here, you personally, with your own hands, are delivering it. And I think that's a very nice position to be in.
That's really true. It's very tangible, I guess, the difference you can make, because you do it with your own hands.
It is. And you can see people being led in who are blind, and a day or two later walking out under their own steam, able to see where they're going. And you together with the team there, I mean, it's not just you yourself, but with the help of the team, you've been able to make a tremendous difference to that individual's life.
And you mentioned the NHS bureaucracy. I sometimes call it the NHS conveyor belt. You just find you're on this perpetual cycle. And when you go out, you really see it's a real sense of fulfillment, what you can do out there and the difference you can make. And that really stays with you, doesn't it?
It does. I think it also, to be honest, helps when you look again at the NHS and you realize it is actually a marvelous institution. And the fact that people can get free care, and not have to worry about finance is an amazing thing. Many, many countries in the world would love to have a system, a tenth as good as the NHS. Doesn't mean to say that when you're working in the NHS, you feel like that all the time. And the effect of having been on one of these trips perhaps only lasts for about 10 minutes after you get back. But nevertheless, it's a tremendous feeling to have. And you realize that actually it's not so bad at home in the UK. And recently, I was in Liberia, and our team operated on one man who'd been blind for 7 years because of cataract. And he was asked, why didn't you have your cataract surgery before? And he said, I just didn't have the money. I just couldn't afford that. It was a few $100s, perhaps $500 in the capital city for cataract surgery. And he was living off, $1.50 a day, and he just could not raise the money for surgery. So this guy was needlessly blind, if you like, for 7 years, just because of not being able to afford an operation.
When you came back after your first expedition, how did you feel, and how did things develop with you from there?
Well, I wanted to continue doing this kind of work, but I didn't really know at that stage how to proceed. And then just by chance, I happened to see an advert in a sort of ophthalmic magazine for a group called C International, which stands for Surgical Eye Expeditions International. They're a group that was founded in the 70s by an American ophthalmologist based in Santa Barbara in California. And they have now many hundreds of ophthalmologists who volunteer to do expeditions in 50 to 60 countries around the world. And I've worked with them ever since. I joined up with them and decided to try to do more or less one expedition a year with them. Not all the expeditions I've done have been through that organization, but the majority have been.
So your first expedition was when you were about 33, 34, and then
yes.
you obviously did some more. And then how did you fit that in around your professional life as an ophthalmologist in the UK, I guess your family life as well, and expeditions? How did you balance all that out?
Well, it wasn't difficult in that it was just most of the expeditions were about a week or so, maybe 10 days in terms of traveling there and back, but a week of surgery. So talking about a 10-day leave period. Sometimes it was study leave, sometimes it was holiday, just a combination of that. But I didn't find that in particular was terribly difficult to organize. And by and large, my colleagues on the NHS were very understanding. And in fact, some of them I managed to persuade to come along on various expeditions that I did. So I think I managed to spread the word a little bit.
What experiences or expeditions stand out for you over the years?
Well, I think perhaps the one that I undertook to Papua New Guinea was the most challenging expedition that I did. Firstly, it was the furthest one away from the UK. I think it took about 30 hours of flying or something like that to get there. And then once in the country, I had to do about 3 more plane trips to get to the site where I was operating, a place called Wewak, which I'd never heard of before, but it's where the Second World War in the Pacific area ended. And I was working with an ophthalmologist who started off, but then after one day he announced to me that he was leaving and he was going off to a conference in Kathmandu. And was this okay? So I was basically left there as the only surgeon doing the surgery, and he left his main scrub nurse with me. But she then got malaria and basically was in a pretty dire state, lying on a table next to the operating theatre and sort of giving advice, but delirious and in a pretty bad way. And I thought, well, things couldn't really get any worse. But then the water supply failed and the autoclaves wouldn't work. And I just thought, well, what else can happen? Anyway, we did manage to do quite a lot of surgery in the end, but it was certainly a very challenging expedition. Actually, they've all been pretty easy in comparison to that one. Some of
Whenabouts
them,
was this trip to Papua New Guinea?
I think that
When was
was
this?
actually my second expedition after Brazil,
Okay.
Santarém in Brazil. I think
Okay.
it was my second one. After that, I didn't go quite so far away. I tended to try to restrict my trips to African countries and places that were, if you like, one flight away rather than 5 or 6 flights away. Interesting places, which unfortunately some of them can't really go back to at the moment, such as
Okay.
Belarus, Burma. I've been to Haiti about 5 or 6 times, but at the moment I don't think I'd go back to Haiti in a hurry, not unless you want to get kidnapped. And I've also been to Liberia recently, which Liberia has a very, very traumatic history, although it's settled down a great deal now.
What was your best experience? What stands out for you, or a collection of experiences?
You know, most of the trips have been very good in their own way. I can't say that one trip has been exceptionally wonderful. Just all the trips, different things happen. I met wonderful people, made associations with a number of ophthalmologists around the world, and continued going on trips with some of these ophthalmologists. Met some amazing patients. Always had interesting experiences, and I wouldn't say really that I could pick out one particular trip that's different and really amazing. They've all been good.
And in terms of some learning points from your years of expeditions, what have you picked up? What would you say has changed you as a surgeon, as a person, even?
Well, on some of the trips, I've actually learned a tremendous amount. I did one trip to Bangladesh where I actually went with Orbis, the Flying Eye Hospital, although it was a ground-based mission, so I didn't go on the actual surgical aeroplane. And in that country, my job was to teach the doctors there phacoemulsification, which is one type of cataract surgery. But they taught me manual small incision cataract surgery, which was in about 2006, I think. And that is now the standard method of manual cataract surgery. And it was a tremendous opportunity for me. As much as I taught them, they taught me. And so I learned a great deal, and I've been able to use that surgical technique ever since. So I've learned a lot. I think I've taught other people a lot, and the process still continues, because I think however experienced you may be, there's always more to learn, and there's always something that you've never seen before, or some syndrome you've never seen, or things like that. You suddenly might see a case that you've spent your entire career learning about things, and suddenly you come across a case of that rare condition. And it's very interesting. I think it's part of the fascination of medicine that you still can keep learning, however old or experienced you might be.
To clarify for our listeners, so phacoemulsification is largely conducted in the West. What we do here in the UK and the US is when we kind of mash up the lens while still in its place in the structure called the capsule. Whereas with the manual small incision cataract surgeries, we're taking the lens out whole, so it requires a different approach, and a different type of incision, which is self-sealing. Do you want to just mention anything about that, Jeremy?
I think the introduction of this technique of manual small incision cataract surgery has made a big difference, because normally you don't need sutures after the surgery. Sutures are quite expensive, and they're also time consuming to put in. So this development of a purely manual technique that's not dependent on high-tech equipment has been a tremendous benefit for underdeveloped countries. and has allowed much more rapid, safer surgery than the previous techniques, which relied on a much bigger incision. But the advantage, if you like, is that you're not dependent on high-tech equipment, which is generally very expensive, very sensitive, and prone to breaking down, and needs servicing and maintenance, which is often something that is not available in underdeveloped countries.
How much does a phaco cost compared to how much a manual small incision M6 costs? And can we illustrate that to our listeners in terms of the big difference and how M6 makes a difference in the developing world?
Well, I think it depends where you are in the world, but M6 surgery, or manual small incision cataract surgery, costs something of the order of $100 a case. In some countries, it is actually considerably less than that, but if you think about it as $100 a case, that's all in with a lens, with the antibiotics, everything included. Whereas for a phacoemulsification surgery, the capital outlay for the machinery alone, you're talking about something between 50 and 100,000 US dollars for the machinery. And the disposable equipment that you use in every case is at least some hundreds of dollars. So you might be talking about $300-400 per case, if not more than that, when you factor in the machinery, versus $100 or less for a manual small incision case. So there's a very big difference in cost.
Thank you, Jeremy. Thanks for clarifying that. Coming back to the talking about expedition ophthalmology, what would you say are the types of skills and qualities an individual needs for this type of work, and what kind of surgeon or what kind of person should one try to be useful in this setting?
Well, I think you have to be quite an understanding person as a surgeon and try not to get rattled when things go wrong, because you can bet on it there are going to be lots and lots of things that don't go according to plan. From your flights getting out there, luggage getting lost, equipment issues, not enough equipment, problems with the staff. You might find that the staff whom you work with are not skilled in cataract surgery, or not that don't speak your language. You may not be able to converse with them. So you have to be very adaptable and keep cool and understanding. Not to say that I'm always like that. I think as I've got older and more experienced, I think I've calmed down a little bit and can cope with adverse circumstances a little bit easier than I did when I was younger. But I think it's a good opportunity to examine yourself and try to learn some of these lessons for your own practice in the UK, about being a bit cooler about things, not being too pedantic about staff, being a little bit understanding, and trying to work as a team. It's all very important. You're not going to be able to do the surgery by yourself. You have to work with other people to accomplish it. So it certainly makes you more adaptable. But I think it's something that many ophthalmologists could do. I don't think you have to be a specially gifted kind of surgeon. I think if you've trained in the NHS and you've gone through the ranks and you're a consultant ophthalmologist, you would be easily capable of doing this kind of surgery with assistance and be able to get into it and to be able to make a worthwhile contribution.
That's really good lessons, and I think something I need to learn as well, because I've found myself that you do feel the frustrations at times, don't you? But you need to realize you need to have that self-talk that with yourself to kind of put yourself back in focus.
Well, ophthalmology is one of these subjects that actually encourages people to be very pedantic and accurate and really concentrate on small details, to be, if you like, an obsessive compulsive neurotic. It's something that actually is encouraged in ophthalmology, but it's not something that is necessarily an ideal personality trait to have in general, but specifically when you do one of these kind of adventures or expeditions, because not everybody necessarily enjoys that kind of behavior, and it's something you have to adapt a little bit. It's not to say you should be lax or do bad surgery, but you have to be able to adapt to the environment in which you work. And we often work with other ophthalmologists in these countries, and you have to be able to adapt to their way of working and fit in with what they do. It's no good sort of imposing what you do back home, but you have to try to help them to encourage their surgery locally.
Okay, and I guess bringing everything together, and I know you've touched upon it earlier, but why do you think this type of work is important? And the second question onto that is, if you hadn't done this, could you imagine your career or your life without having done all of these expeditions?
Well, I think the reason we should do it is to get able to give something back. I think we are extremely privileged in the West. We've had, I know I've had a amazingly easy life in comparison to many of the people that I meet on these expeditions. We've had the benefit of financial security, education, security in living standards, food, and so forth. And I think by making a very small sacrifice, you can actually give back some of these advantages that you've had in your life. And I think it's pretty incumbent upon everybody to contribute in some way. Maybe it's not everybody's cup of tea to go out on these kind of expeditions, but you can certainly contribute to organizations that do this kind of surgery. And if you feel capable, I think it's actually a wonderful way of adding to your career, doing something good for mankind, and giving back some of the great advantages that you've had in your own lifetime. Whether it's a hard thing to know what I would have done if I had never done these kind of expeditions. It's certainly something I've been interested in for a long time. I mean, I guess I would have done more work on the NHS, which is also extremely valuable. I mean, you do make a big difference to people on the NHS. But I think for me, it's been an invaluable addition to my career, and it's certainly something that I've really enjoyed. I think it's about as much fun as you can have as an ophthalmologist. And while you make a good contribution, you have a great time. And it tends to make you, it opens your eyes to the speciality. You actually realize, hey, this is why I became a doctor in the first place. I'm doing stuff here that I really trained for and wanted to do my whole career. And I'm on one of these expeditions and I'm actually doing it now. This is what I trained my whole life for. So I think it's an amazing opportunity.
Yeah, because you realize you actually make a difference.
Yeah, absolutely.
Yeah, wonderful. I think that's a very good note to summarize on and draw things to a conclusion there, because the World Extreme Medicine audience is a very broad audience, but a lot of our listeners are doctors in their F1, F2 years, new medics trying to figure out the path for them, the specialty they want to join. And certainly myself, when I was a junior, this aspect of ophthalmology isn't something that's readily known. People aren't particularly aware that this is something that they can do. And I hope our discussion today has highlighted that, and there's a really big difference that can be made, and ophthalmology is a very good route to allow you to do that, and to make a difference in the world. Would you agree, Jeremy? And I know there's obviously many specialties, but I do find just with sight, with blindness, with cataract surgery, the simplicity of it, and how many the volume you can get through on an expedition can really make a difference to small communities.
Yep, absolutely. I think you've summarized it very well. There are lots of other specialties, obviously, that can make a huge difference. People who do, for example, cleft lips and cleft palates, club foot surgery, things like that make an enormous difference as well. I think we're very lucky as ophthalmologists in that we can use our skills to do a relatively simple, relatively straightforward operation, and yet make such an amazing difference between somebody being blind for the rest of their life and somebody being able to see normally and be able to look after themselves and to lead an independent life after a cataract operation. So it's a wonderful opportunity to have as a surgeon.
Thank you, Jeremy. That's a great way to end things. With those words, I'd like to thank you for your time, and we'll meet up soon, I hope. For the audience, you can always get in touch with us here at World Extreme Medicine if you want to find out about other opportunities to go on expeditions. If you want to find out about the opportunities you can obtain with some of the organizations we've mentioned today, such as SEE International, SEE International. Jeremy, thank you so much for your time. Really appreciate it.
Thank you, Pav. It's been a pleasure.
Hopefully be seeing you soon. And we'll probably go out somewhere soon, probably South America next, and I look forward to that.
Absolutely.
Okay, so thank you.
Thank you. Thank you, Pav. Thanks for having me. It's been a pleasure.
Thanks for listening to the episode. Please feel free to rate, review and subscribe on whichever platform you're listening to. Please also head over to the World Extreme Medicine website, where you can find more engaging content on extreme medicine webinars and indeed the collection of courses from our global network, including humanitarian, disaster relief, expedition, space, military, tactical and performance medicine. Thanks again.